Today, we explore a very common question. Does cracking your knuckles actually cause arthritis or joint damage? Many people habitually crack their fingers every single day, enjoying that satisfying popping sound, while others cringe at the loud noise. To understand what happens when you crack your knuckles, we must first look closely at the basic anatomy of human hands. Your fingers connect through specialized structures called synovial joints, which allow for a wide range of smooth and highly flexible movements. Inside these fascinating joints, two bones meet and are completely surrounded by a protective layer known as the tough joint capsule. This capsule is lined with a special synovial membrane that continuously produces a thick liquid to keep the entire joint lubricated. Synovial fluid has a consistency very similar to raw egg whites, acting as a natural shock absorber for your delicate bones. This incredible fluid prevents your bones from painfully grinding against each other during your daily activities, ensuring smooth and effortless motion. Now, let us examine the actual mechanism behind that famous cracking sound that so many people find both relaxing and alarming. A popular myth suggests that the loud popping sound comes from your bones violently snapping together or bursting bubbles popping loudly. However, scientific research reveals a completely different and fascinating physical process happening deep inside the protective fluid of your knuckle joints. When you actively stretch or bend your finger to crack it, you are physically expanding the space inside the joint capsule. Expanding this enclosed space causes the internal pressure to drop rapidly, creating a sudden vacuum effect within the thick synovial fluid. The synovial fluid contains naturally dissolved gases, including nitrogen, oxygen, and carbon dioxide, which are essential for normal cellular metabolic functions. As the pressure suddenly decreases, these dissolved gases are rapidly pulled out of the liquid solution to form a microscopic bubble. This rapid formation of the gas cavity, rather than a bubble popping, is what actually creates that distinct and loud sound. Scientists refer to this specific physical phenomenon as tribonucleation, a fascinating process where sudden separation creates tiny gas cavities in fluid. Once the joint is cracked, it takes about 20 minutes for the gases to fully dissolve back into the synovial fluid. This explains why you cannot immediately crack the exact same knuckle again right after you have just heard that popping sound. So, the ultimate question remains: does this rapid bubble formation actually cause long-term damage or lead to painful joint arthritis? Medical experts and numerous extensive studies have conclusively shown that the simple act of forming these gas bubbles is completely harmless. A famous researcher even cracked joints on his left hand daily for 60 years, while leaving his right hand completely untouched. After 6 decades of continuous knuckle cracking, X-rays revealed no difference in arthritis development between his left hand and right hand. Therefore, the popping sound itself and the harmless gas bubbles do not directly cause any form of arthritis in your fingers. However, before you start cracking your knuckles constantly, there is a very important warning you must consider regarding your joint health. The real danger lies not in the tiny bubbles, but in the extreme physical postures you use to achieve that pop. When you aggressively force your joints into hyperextended positions, you place immense and unnatural stress on the surrounding supportive tissues. Using excessive physical force to bend your fingers backward or sideways can severely stretch the vital ligaments holding your bones together. Ligaments are strong but relatively inelastic bands of connective tissue that provide crucial stability and structural integrity to your finger joints. Repeatedly overstretching these important ligaments can gradually cause them to become loose, significantly reducing the overall stability of your hand joints. Furthermore, forcefully twisting your knuckles can also cause painful micro-tears in the tendons connecting your active muscles directly to your bones. Over time, this aggressive mechanical stress may lead to chronic inflammation, persistent pain, and a noticeable decrease in your grip strength. Some individuals develop a psychological habit of intensely cracking their knuckles whenever they feel anxious, stressed, or simply bored during work. If you must crack your knuckles, specialists highly recommend using gentle pulling motions rather than applying aggressive twisting or bending forces. Gentle traction along the natural axis of the finger can safely release the joint pressure without damaging the surrounding structural tissues. It is also crucial to maintain strong hand muscles through regular exercises to properly support your joints and prevent accidental injuries. Simple hand stretches and grip strengthening routines can significantly improve your joint health and reduce the constant urge to crack knuckles. If you experience sharp pain or noticeable swelling while cracking your joints, you should immediately stop and consult a medical professional. Painful popping might indicate underlying mechanical issues, such as cartilage wear, tendon displacement, or early stages of actual joint degenerative diseases. Always listen carefully to your body warning signals, as healthy joints should never feel painful during normal movements or gentle stretching. In summary, the satisfying sound of cracking knuckles is merely a harmless physical reaction involving dissolved gases inside your joint fluid. You do not need to worry about developing arthritis simply from the harmless gas bubbles forming inside your synovial joint capsules. Just remember to be gentle with your hands, avoiding any extreme hyperextension or forceful twisting that could damage supporting ligaments. Treat your complex hand joints with respect, and they will continue to serve you perfectly well throughout your entire long life. Thank you for watching, Video Creator. We hope you learned something valuable today, so please subscribe and stay tuned for more.